I want to start today by sort of asking you to pull up a mental image. It's a bit of a cliche, but just stick with me for a second. Picture a doctor in an emergency.
Okay. Yeah, I'm with you. Sirens, a gurney moving way too fast down a hallway, someone, barking orders.
Exactly. And the doctor.
Yeah.
They are the absolute calm center of that storm, right? While everyone else is, freaking out, the doctor is just stoic.
Mm-hmm. Precise.
Right. They're running toward the disaster when the rest of us are running away. It's the classic superhero thing, just, with a stethoscope, not a cape.
It is. We see them as the fixers, the people who don't get tired, they don't get scared, and they certainly don't break down.
Never. But the sources we have today, they really take a sledgehammer to that image. We're looking at How Do You Feel? By Dr. Jessi Gold. And it asks this genuinely terrifying question. What happens when the helpers are the ones who are drowning?
And that is a question that I think most of us really try to avoid, because if the doctor is drowning, well, who's there to catch us?
Exactly. Now, Dr. Gold, she's a psychiatrist, but this is not a textbook. Not at all. It's a memoir. It's also kind of a confession.
Yeah.
It's a really brutal look behind the curtain of the medical world at the mental health crisis that's happening within the workforce itself.
And I think it's important to state our mission here up front. We're not just, telling sad stories about tired doctors. We're trying to unpack a specific concept that Dr. Gold talks about called the hidden curriculum.
I had never even heard that term before.
Right. And it's basically the system that, for generations, has taught doctors to suppress their own humanity.
It's everywhere once you see it.
Yeah.
So today we're going to explore the cost of that curriculum, the cost of caring, maybe too much, in a system that demands perfection. Because this story isn't just about her patients. It's about her own fight to just be human while wearing the white coat.
And that's what makes it so powerful.
It really is. I mean, reading this, Dr. Gold is just shockingly relatable. She's not some distant academic. She's messy. She loves pop culture. She makes mistakes.
That's why the book works. She's our guide through this world, but in a lot of ways, she's also the patient.
Okay, so let's just jump right in. The book doesn't start with her, winning an award or saving a life. It starts with a scene that I think is basically a horror movie for any perfectionist out there.
Oh, it's the moment the cracks just,
Yeah.
they become a canyon.
So set the scene for us. It's the peak of the pandemic. Dr. Gold says she's at rock bottom.
Right, so she's working from home, doing all her appointments over Zoom, and she paints this picture that I think so many of us can relate to from back then. She's wearing a fleece that says, Department of Psychiatry to look professional.
The top half.
But below the camera, it's just sweatpants.
Zoom mullet. Business on top, chaos on the bottom.
Exactly. But it's deeper than that. She talks about barely showering, eating junk food, and just running on what she calls semi-autopilot.
Wow.
She's seeing 10, maybe more patients a day, back to back, just absorbing all of their trauma while she herself is barely holding it together.
And then the mistake happens. She logs into a Zoom call with a patient. His name is James. She sees his face, she sees the name, and it's nothing. It's a total blank.
So she just defaults to doctor mode.
She just launches right into the standard script. Super upbeat. Hi, I'm Dr. Gold. Nice to meet you. What brings you here today?
And you can just feel the silence that follows. It just hangs there in the air.
Yeah. And James's face, she says it shifts from just tired to angry. And he says, I know you, Dr. Gold. We met 3 weeks ago.
Oh, that is the nightmare scenario.
I physically cringed when I read that part. But look, people forget names. It happens. If I did that, I'd be embarrassed. I'd apologize. We'd move on. But Dr. Gold doesn't just get embarrassed. She implodes.
And this is where we have to pause. Because her internal monologue, what she thinks in that moment, it tells you everything you need to know about this medical mindset.
She doesn't think, oops, I'm overworked.
No, her first thought is, I hate me.
I hate me. It's just so extreme.
She thinks, doctors don't make mistakes like this. She's instantly convinced herself she's destroyed the entire therapeutic relationship. It's catastrophic shame.
So why is that reaction so incredibly intense? Is it just her personality?
I think it's the training. This is our first real look at this theme of perfectionism. I mean, notice her empathy here. It's all directed outward. She's heartbroken for James. She feels awful that she made him feel unseen.
So she has endless empathy for him.
But for herself, absolutely zero.
She treats herself like a broken machine.
Exactly. In her mind, a doctor is supposed to function perfectly. If she forgets a name, if she makes a mistake, the machine is broken, she failed.
It's so binary. You're either perfect or you're just Garbage.
And that binary thinking, it's not something she was born with. It's something that was trained into her.
Yeah, and the book traces the roots of this. It takes us back to medical school to show how this whole perfect robot idea gets built. There's this one scene, a flashback to a pulmonology workshop. It sounds awful.
Ah, yes. The dreaded icebreaker.
The absolute worst. The professor asks everyone to go around, say their name and what specialty they want, and the room is just... She says it's vibrating with competition.
She calls them gunners.
Gunners.
Yeah, it's a med school term for the hyper-competitive students, the ones who are just laser-focused on getting ahead.
So everyone's announcing they're going into dermatology or ophthalmology, all the really high-prestige, high-paying specialties.
It's a status game. They're not sharing their dreams. They're reading off their resumes.
Totally.
Yeah.
It's a flex. And then the circle gets to Jessi. And she says, "My name is Jessi Gold, and I'm not even sure I want to be a doctor."
Oh, man. You can just imagine the silence.
Yeah, read the room, Jessi. But okay, looking even further back, she talks about her childhood and this drive. It didn't start in mid school. She said she grew up in a family where achievement was the oxygen.
What a phrase.
Isn't it? Achievement was the oxygen. As in, if you aren't winning, you literally cannot breathe.
Her siblings were all at Ivy Leagues. They were swim team captains. Our dad had this joke that they competed with a number 2 pencil.
Meaning they were basically professional test takers.
Exactly. And when you grow up like that, you start editing yourself. She talks about making childhood resolutions like don't cry and don't make faces. She was training herself to suppress emotion long before she ever put on a white coat.
Which brings us right back to that term you mentioned at the top, the hidden curriculum.
Yes. This is a key concept, first coined by researchers named Hafferty and Franks.
So break it down. We all know the formal curriculum, right? Anatomy, pharmacology, all that. What's the hidden one?
The hidden curriculum is everything you learn implicitly. It's what you absorb in the hallways watching the senior doctors. It's the unspoken rule that doctors don't have feelings, you don't struggle, and you hide weakness at all costs.
So if you're exhausted, you don't say it.
Yeah.
If you're sad about a patient, you bury it.
Precisely. And if you do admit you're struggling, the message you get is that you aren't just having a bad day. You are a bad doctor. You're a liability.
It sounds like a form of hazing, almost. I suffered through it, so you have to suffer too.
It's institutionalized suffering, but it's disguised as building toughness.
And that crisis became so visible during the pandemic, which I want to talk about the case of Luke. This section of the book really, really stressed me out.
It's an incredibly striking case. So we're in March 2020. Dr. Gold is working remotely, and one of her patients is Luke, who's a resident physician.
And the visual she describes is so telling. He's on the Zoom call wearing his white coat and a bow tie. He looks the part. He looks completely pulled together.
But his behavior says something else entirely. He's constantly looking over his shoulder, terrified someone will hear him talking to a psychiatrist.
And his fear. It's about COVID, obviously, but it's not just, I don't want to get sick. It's so much more than that.
It's moral terror. He's not just scared he'll catch the virus. He is utterly consumed by the idea that he will get it, be asymptomatic, pass it to a patient, and kill them.
The details are they're intense. He talks about sitting at his computer, just hitting the refresh button over and over and over, waiting for COVID test results to come in. And the hand washing?
The hand washing is the classic tell. He says he has to sing happy birthday, which is what they teach you for timing, but he has to sing it 3 times.
3 times? Why 3?
It's the ritual. That's the compulsion. He can't leave the sink until it's done 3 times. If he gets interrupted, he has to start all over again.
And he's triple-checking his PPE, his mask, his gown.
Right. And Dr. Gold recognizes this pretty quickly as OCD, obsessive-compulsive disorder. And I want to be clear here because people use OCD as slang for, being neat. That is not what this is.
Right. Lay it out for us.
You have the obsession, which for Luke is that intrusive, terrifying thought, I am contaminated and I will kill someone. And then you have the compulsion, the washing, the checking, which is the ritual he performs to try and neutralize that anxiety.
But the relief never lasts.
It never does. It's a feedback loop. The more you do the compulsion, the more your brain reinforces the original fear.
So how do you even treat that? You can't just tell him, stop washing your hands. I mean, not during a global pandemic.
She recommends a type of therapy called exposure and response prevention, or ERP.
She used a great analogy for this. She called it clinical fear factor.
Yes. That's a perfect way to think about it.
So if you're scared of snakes, they don't just keep you away from snakes. Eventually, they put you in a tank with the snakes.
That's the exposure. You have to face the thing that scares you. But the response prevention part is crucial. So you have to say, touch a doorknob, feel that spike of anxiety, and then not immediately wash your hands. You have to sit with that terror until your brain learns, oh, nothing bad happened.
You're basically rewiring your own alarm system.
Exactly. But the real tragedy with Luke isn't just the OCD. It's why he waited so long to get help. He's a doctor. He knows the signs. But he was terrified of being seen as a burden to his colleagues.
That word burden, it comes up so much.
It does. And there's this dirty little secret in medicine about getting your license renewed. In many states, the forms ask questions like, have you ever been treated for a mental health condition?
Wait, are you serious? So going to therapy could actually risk your career.
That's the fear, and it's a very real fear. It's changing now thanks to a lot of advocacy, but historically, yes. Doctors worried that seeking help will get them flagged as unfit by the medical board, so they just suffer in silence.
Which has lethal consequences. There's a statistic in here that it stopped me cold. A study found that nearly 1 in 15 physicians had suicidal thoughts in the past year.
1 in 15. Just think about that. It's a staggering number, and it is directly tied to this culture of silence and perfectionism.
It makes you wonder, who's taking care of the caretakers?
That is the central question of the book. And it's interesting because Dr. Gold's path into psychiatry, she actually tried to run away from it at first.
Yeah, let's talk about that. Her dad was a famous addiction psychiatrist, so, huge shoes to fill. She was like, nope, I'm doing neurology, the brain, but the physical hardware.
She wanted the hard science, what the medical hierarchy would consider real medicine. Psychiatry is often looked down on as a soft science by other doctors.
But then there's the story of Rosa. This feels like the big turning point.
It's such a beautiful and really heartbreaking story. So Jessi is just a med student at this point. Rosa is an elderly patient with COPD, and she starts to crash. She's having chest pain. The whole medical team rushes in.
And they're doing everything right by the book. They're hooking up the EKG, drawing blood.
Yeah.
They're focused on the data.
But in the chaos, they've exposed Rosa's chest.
Yeah.
And she's terrified, she's screaming, she's praying, and nobody's looking at her. They're all looking at the monitors.
Except Jessi. The student in the corner, she sees Rosa is scared and exposed, and she just walks over, covers her with a blanket, and holds her hand.
And Rosa looks at her and calls her Cookie.
Cookie.
It's so human.
It is. And the lesson Dr. Gold learned in that moment was profound. She realized she couldn't distance herself like the other doctors. She couldn't just turn off her humanity to focus on the machine. And she started to wonder if maybe that wasn't a weakness. Maybe that was actually her strength.
Which leads her to psychiatry. But she definitely does not fit the stereotype.
Not at all. She jokes about the classic image, right? The old white man in a tweed jacket nodding silently.
Right, and she's a millennial with curly hair who still gets carded at bars.
And she refuses to use the therapy voice. You know that fake, calm, almost radio DJ voice?
And how does that make you feel?
Exactly that.
Yeah.
She just talks like a normal person. There's this great story where a patient is going through a breakup and says something like, we are never getting back together.
And Dr. Gold immediately quotes Taylor Swift back at her, like ever. She does.
Yeah.
And the patient actually calls her out on it, but it works. It breaks the tension. It shows that there's a real person in the room with her, not just a blank screen.
That authenticity seems to be your superpower. But there's the flip side, right? Being that open, being that empathetic, that has to come at a cost.
It does. In psychiatry, your own emotional reaction is part of the diagnostic toolkit. Which brings us to this idea of countertransference.
Okay, let's unpack that because it sounds technical, but the story she uses is so visceral. It's the story of a student named Naya.
Right. So Naya is a pre-med student. She missed her MCAT, the big medical school exam, because of a car accident. And she is just spiraling, saying, I'll never be a doctor now.
And as she's listening, Dr. Gold isn't just hearing it clinically. She feels it physically.
Right.
She actually gets nauseous. She remembers her own anxiety taking the ACTs, throwing up before the test.
That is countertransference.
So break that down.
Okay, so transference is when a patient projects feelings onto their doctor. So they might treat their therapist like a critical parent, for example. Countertransference is the reverse. It's when the therapist's own history and feelings get triggered by the patient.
It's like the patient plays a note, and the doctor's own strings start to vibrate with it.
That is a perfect way to put it. In most of medicine, You know, if a patient has a broken leg, your leg doesn't start to hurt, there's a separation.
Right.
But in psychiatry, you have to ask, how is this patient making me feel? Because that feeling is data. If they make you feel hopeless, maybe that tells you something about their depression. But it means you are constantly marinating in these really intense emotions.
She describes it as feeling like you're being eaten alive sometimes.
Yeah.
There's no clocking out from feeling that deeply.
And if you combine that emotional weight with the hidden curriculum that says, never show that you're hurting, you have a recipe for burnout. It's a pressure cooker with no release valve.
It's unbelievable. We expect our doctors to be these perfect robots with the skills of a surgeon and the compassion of a saint, but we deny them the basic maintenance of being human.
And that's the paradox at the heart of the whole book.
So as we wrap up this deep dive into how do you feel, what's the big takeaway? We've gone from the perfect stoic doctor to this messy human reality.
I think the most important thing is that the hidden curriculum, it doesn't just hurt doctors, it hurts patients. It hurts all of us.
How so?
Because when a doctor is forced to suppress their own humanity, they can't connect with yours. Think about Rosa. The team saved her heart rhythm, but they completely ignored her terror. Dr. Gold's argument is that healing requires humanity. And real humanity means being able to admit, I'm not fine.
It's about breaking that silence.
It is. Dr. Gold telling her own story, admitting she was depressed, burnt out, making mistakes, that is an act of service. It gives her patients permission to be imperfect, too.
That's a huge shift. It changes the whole dynamic from, I am the all-knowing expert who will fix you, to, we are two human beings figuring this out together.
Exactly.
I'm going to leave everyone with a final thought today. We've talked about the system, the burnout, all of it. But just think about the last time you saw a doctor. Did you really want them to be perfect? Or did you just want them to be present?
That's the core question, isn't it?
If we keep demanding that our healers be superhuman and emotionless, who is going to be left to save them when they inevitably break? And maybe more importantly, do we actually want a doctor who doesn't feel anything? Or is it their humanity, their ability to feel, that actually heals us?
I think we know the answer.
Dr. Gold certainly thinks so. Thanks for listening to this deep dive. Take care of yourselves and maybe, check in on your strong friends today.
Absolutely.
We'll see you next time.